This is Sleep Better TV. I'm Scott Drake. My guest from his offices at Dental Sleep Medicine of Vancouver, Washington is Dr. Blake Perkins. We're talking about the treatment of sleep breathing disorders. Dr. Perkins, welcome back. Let's discuss snoring. Why do people snore?
Generally, people typically snore because there's a partial blockage of their upper airway. Usually, the soft palate and the uvula is enlarged and falls down and kind of makes their airway small, but it's also a little bit loose. And if you imagine it not unlike a sail on a sailboat where one of the lines has come loose and starts to flap in the breeze, when you're asleep and the back of your throat relaxes, that tissue also becomes very relaxed, and as you breathe in and out, it vibrates and causes a snoring sound.
Now, is snoring always dangerous, or is it always sleep apnea?
Snoring is not always dangerous, nor is it always sleep apnea, but there's a great percentage of people who have snoring at night that actually have an underlying condition of obstructive sleep apnea.
So what can happen if a sleep breathing disorder goes untreated?
Oh, that's a very good question. Untreated sleep disordered breathing can have a dramatic effect on overall health, not just the health of the individual, but there are also some societal costs that come along with it. To name just a few, hypertension or high blood pressure, diabetes, periodontal disease or gum disease that we see as dentists. Obesity is also tied to obstructive sleep apnea, as well as a host of other physical and neurological conditions.
And let's review again, how does a dentist typically treat this problem?
Well, the first step I always take is to kind of get a history of what's going on with the patient. How long has the snoring been going on? Is it affecting their bed partner or somebody else in the house? And then the next step is to actually have them get tested by a sleep physician via a overnight sleep study. Once we have the results from that, then we know which direction to go in order to treat their sleep disordered breathing.
Dr. Perkins, finally, do you work with a physician?
Absolutely. I work with a lot of physicians in our area, and we work together as a team mainly because there's no one single effective approach to treating a patient. It involves a lot of people making sure that everything is done in the best interest of the patient.
All right, great information as always, Dr. Perkins. Thanks again.
You're very welcome.
My guest, Dr. Blake Perkins. You can find him at Dental Sleep Medicine of Vancouver, Washington, and you're watching Sleep Better TV.